Okay, so this presentation is about Botox for pain management.
Talk loud.
When people hear about Botox, they envision this. They think that this is what happens when you get Botox. And this is not true. This is also what other people see when they get Botox as well. Botox is not only used to treat wrinkles or fine lines, it's also used for pain management. So, for example, migraines. You can get Botox in between your eyebrows. You can also get it on your temples, in the back of your head, on your neck. Botox is used for many different things. For example, again, migraines. This is where it would be used to be treated. So in the forehead, the temples, the back, along the muscle here, and again in the back of the neck. So when patients get Botox for migraines, there is a little bit of redness, sometimes swelling and bruising to the injection site. It also can be used to help with back pain. So, for example, with back pain, it can be used on the lower back, injected into the muscle, again along the muscle with the neck. And this really helps with, again, any lower back pain that chiropractic work does not help for. Here is one other example how it can be used to treat on the spinal cord, which is right here along the back. There was a study shown that 75 patients, it was conducted over 14 months, and each patient either had a dose of 40 to 50 injections, and after their first 3 treatments, there was 50% improvement in back pain. There was also another study shown which helps with issues in the brain. And this was done under a CT scan, so it was injected along this muscle here. And this helped with activity in the brain that caused migraines, anyone that suffered from PTSD or anything like that. So with Botox injections, again, there are also side effects. So with the side effects is injection to the little bit of redness, bruising, swelling, a little bit of numbness, depending on the injection site. So in the back or along the neck, there can be numbness in your fingers, but that doesn't always happen to everyone. There is updated treatments that have to be done every 3 to 4 months, and ice packs, resting can basically help this area. So, no exercising 72 hours after treatment, no blood thinners, so no ibuprofen, aspirin, or anything that can thin the blood, which can cause bleeding. Again, no drinking alcohol 72 hours after as well. Drink lots of water and get lots of rest. Is there any questions?
Where exactly does Botox, is it a chemical compound or is it a natural substance?
So Botox is a botulinum A toxin, which is a protein. So it's a protein that also is found in the body, which that's why a lot of people don't reject it. So it helps a lot of people. Any other questions?
What about labor afterwards?
Like with pregnancy?
No, labor like work.
You can go to work right after. You just can't do any heavy lifting, exercising. So you can always get a doctor's note to make sure that it's okay for you to return to work. But normally people go on their lunch breaks to get this procedure done. They go on their little breaks before work, after work. So there's no really limitations. Any other questions?
What about hematuria?
It does not help for that. You need ice packs. No ibuprofen. No blood thinners for you.
How long will this take to go away?
Well, that can take a couple months.
That's what the doctor said, 2 months.
Yeah, well, because they get bigger. So it'll get bigger before it gets smaller and go away. I know that.
What did you say? How many units of Botox for back pain?
Sometimes, well, it just depends. Like the doctor can recommend sometimes 50 units, sometimes
50?
Sometimes smaller, like 20 units, just to see if it works and to see if you can take the medication or not, to see if it's going to be effective.
What's a unit cost about? I know it's different.
I'm not sure. Some places they can charge like $4, sometimes $12. So and then a lot of times if it's used for migraines or back pain or hip pain or anything like that, I know the insurance
covers it.
They can try to cover it.
And where do you go for these Botox treatments if you wanted them?
You can go see your doctor, and they can refer you to someone else. You can go to a medical spa. I would first talk to your doctor just to make sure that this treatment would work first before trying it. Anybody else?
Good job.